beginning of our discussion of muscle, we talked about, very briefly though, the three types of muscle tissue. We've had an in-depth study of the anatomy, all the pieces, the structures that make up skeletal muscle, and we've talked about the way those pieces and parts work together for muscle contraction and the things that can affect that. We'll look very briefly here at cardiac muscle tissue and smooth muscle. Cardiac will be covered in depth when you reach the unit on cardio, probably not until your AMP2 class, but we will talk just a little bit about that now. So the principal tissue in the heart is cardiac muscle tissue. Cardiac muscle fibers have the same arrangement of actin and myosin and the same bands, the zones, the Z-disc, as we saw in the skeletal muscle. Because of that, the fibers appear striated. As you see here, your skeletal muscle, and here, your cardiac muscle, you get that same overlapping bands of connective tissue giving that striation. However, intercalated discs are unique to the cardiac muscle tissue. The intercalated discs contain desmosomes, which hold the muscle fibers together. Remember back in the early parts of the semester we talked about the different types of cellular junctions, and desmosomes were those sort of spot welds that hold cells closely together. And then also as a part of the intercalated disc we have gap junctions. Gap junctions allow muscle action potentials to spread from one cardiac muscle fiber to another as ions pass through those gap junctions, much like dominoes falling into the next cell and causing an action. We've seen that skeletal muscle tissue contracts only when it's stimulated by acetylcholine from a motor neuron. In contrast, cardiac muscle tissue contracts when stimulated by its own autorhythmic muscle cells. So there's a cardiac conduction system within the heart, which is a specialized group of cells that are autorhythmic. They depolarize and then cause contraction on their own, and they do so about 70 times a minute from the time your heart is formed until the time your heart stops beating. Again, you'll get much more on cardiac muscle as we move on into anatomy 2 and we talk about the cardiovascular system. However, we don't have a particular unit or a chapter on smooth muscle because smooth muscle, much like skeletal muscle, is found throughout the body. So we will take just a few minutes and review some of the anatomy and physiology of smooth muscle. When you look at the anatomy of smooth muscle, you'll see in this small little image here that it is very different from what we saw with the cardiac muscle and the skeletal muscle. So the muscle cells are not striated. They're not long cylindrical branches. They're not long cylinders as we saw with the skeletal muscle. So your muscle fibers in your smooth muscle are arranged in sheets, and they're somewhat spindle shaped, so they're larger in the center and then sort of come to a point at each end. Also, your smooth muscle tissue is uninucleated, so only one nucleus per cell. You do have some connective tissue coverings, though not the epimysium or perimysium that we saw in skeletal muscle, and your smooth muscle tissues are aligned in sheets of opposed fibers. So one sheet will have cells running in one direction, the underlying sheet will have cells running in another direction. So these sheets of cells are going to be able to contract and move things throughout the body rather than move the body. So your smooth muscle is going to line a lot of your hollow organs, such as the organs of your digestive tract, the blood vessels that run through your body. And as these layers of smooth muscle contract, they can move things through your body. Think about the action of swallowing your food. From the time you put food in your mouth and you chew and then you swallow, that's the last voluntary control you have over that muscle. So a rhythmic contraction of that smooth muscle, beginning at the esophagus, through the stomach, through the small intestine and the colon, the rectum and the anus, a rhythmic contraction that you see here being illustrated, known as peristalsis, moves that bolus of food throughout your digestive tract. So here you can see lining the small intestine, you have a sheet of smooth muscle tissue and another sheet of smooth muscle tissue. Notice how the cells of these two layers of smooth muscle are running in different directions. So when each one contracts, it's pushing in a different direction. This is allowing substances to be propelled throughout that tract. Smooth muscle also, as I mentioned, is involuntary, so we don't have control over those contractions. Because that smooth muscle does contract and sometimes can lead to what we feel as painful cramps. Sometimes you will feel these cramps in the urinary bladder or the rectum, or what we commonly call stomach cramps. Smooth muscle cramps of the uterus help women to expel the smooth lining of the uterus each month if pregnancy didn't occur. It also allows us to push by contracting that smooth muscle and moving babies out of the uterus through the vaginal canal during the birth process, but also the contraction of these smooth muscles lining your respiratory tract can lead to asthmatic conditions as these muscles contract. Remember, the structure that they are lining is getting smaller in its diameter. Smooth muscle contraction does have a few things in common with skeletal muscle contraction in that we have the normal sliding filaments, the actin and the myosin. We have the increase in the calcium inside the cells that is going to trigger that contraction, and we've got to have the good old ATP to provide the energy for those contractions. A couple of the differences that we see in smooth muscle as compared to skeletal muscle is that between smooth muscles we have gap junctions that allows for that action potential, that flow of ions to be transmitted from cell to cell. So the cells are somewhat electrically coupled, and also there are pacemaker cells that set the rate of contraction for the entire sheet of muscle cells, and these can be self-excitatory. You also notice here, rather than having a motor neuron stimulating these smooth muscle cells, we have autonomic neuron little swellings called varicosities that house some of the neurotransmitters that can affect the way these smooth muscles contract. Additional differences from skeletal muscle are that calcium activates the myosin through two regulatory molecules known as calmodulin and myosin kinase. These are not found in our skeletal muscle contraction, but the way these work actually slows the muscle contraction down so that it doesn't happen as rapidly, but it does allow the muscle contraction to have a more prolonged contraction. Therefore, the skeletal or the smooth muscle uses less energy, but they are capable of making ATP through aerobic respiration, so the Krebs cycle in the electron transport chain. Continuing to look at a comparison between smooth muscle and skeletal muscle, we do find that both types of muscle are similar in that they respond to acetylcholine. Remember, that was our neurotransmitter, but they're different in the types of nervous system cells that can have an effect on their contraction. Skeletal muscle was stimulated by somatic nerves, the nerves we call of the body. Your smooth muscles are stimulated by autonomic nerves. Autonomic, you should think of automatic and related to your organs. Smooth muscle responds to more than just acetylcholine. Neurotransmitters can determine how these muscles respond. Acetylcholine actually narrows the bronchioles. So the bronchioles are going to have a smooth muscle lining around them, and those are tubular structures that are a part of your respiratory passages. So acetylcholine causes the muscles to contract, and so your bronchioles become smaller. Norepinephrine, which is a part of what we call adrenaline, is going to cause those same muscle fibers in the bronchioles to relax, and therefore it increases the diameter of those passageways and allows for more oxygen, more gases, respiratory gases, to get into the respiratory system. Other things can affect the way that smooth muscle contracts, such as hormones, changes in pH, respiratory gases such as oxygen and CO2. Temperature can cause blood vessels to dilate or constrict, and remember, blood vessels are lined with smooth muscle. And ion concentration, which has an effect to change pH or change the concentration of fluids in and around these cells, can cause the cells to relax or to constrict. Also, another characteristic is the ability to respond to stretch, and this is what moves, the primary stimulus that moves food through the digestive tract. So increased stretch provokes increased contraction. All right, so that's sort of an overview of smooth muscle. You can see that it is very different in many of its characteristics from the study that we just completed on skeletal muscle. So let's look at a few interesting facts here. The difference in male and female body comparing muscle mass. Typically, males will have a larger percentage of muscle mass as compared to females, with usually over 40% of men's total body mass being composed of muscle, with about 35 to 36% in a typical female body. Now, this does vary from person to person, but this is just an average. So the strength per muscle mass is generally about the same, but because males have more muscle mass, they do tend to have greater strength. Strenuous exercises cause muscle enlargement in males more so than females because of the differences in the sex hormones. Males have a higher level of testosterone, which is a steroid hormone, and that testosterone has a higher rate of increasing muscle mass than does estrogen. Synthetic steroids, synthetic male hormones, can be injected and cause increases in muscle mass. Now, this can be done in a clinical setting where it can help to treat diseases of muscle wasting or loss of strength, but it can also be misused in the gym and very often done by people that are in muscle building or bodybuilding competitions so that they can build that increased muscle mass and have an unfair advantage over those that are trying to do it the right way. All right, so let's look briefly at some homeostatic imbalances. The first we'll look at is muscular dystrophy. Muscular dystrophy is an inherited group of muscle-destroying diseases that causes a progressive degeneration of skeletal muscle fibers. The most common type of muscular dystrophy is the Duchenne muscular dystrophy. Because the mutated gene is only found on the X chromosome, more males will have it than females because they only have one X chromosome. So having that one copy of a faulty gene can lead to the disease. About 1 in every 3,500 male babies that are born worldwide each year have DMD. The disorder usually becomes apparent between the ages of 2 and 5 when parents start to notice that their child is falling when they're walking and running and just moving around and doing the normal things that children do. By about age 12, most boys with DMD are unable to walk, and respiratory or cardiac failure usually causes death by about the age of 20. So the muscle fibers are lacking a protein called dystrophin. That dystrophin helps to hold the muscles together, so it stabilizes the extracellular matrix, and when that fiber is not created properly, then the muscles tear during regular muscle contraction. There has been a lot of work done on this, including some genetic therapy that has had various types of results, most of which have not been extremely promising. They are looking now at trying to find a way to induce muscle fibers to produce a protein that is very similar to the dystrophin, and hoping that that will help to create more muscle cells that will be able to withstand those contraction forces. Some additional terms that we'll look at, you may hear of fibromyalgia. This is a very difficult to diagnose disorder because it is so widespread throughout the body and associated with connective tissues of the muscles. So it results in tenderness and fatigue, and often very difficult to diagnose because it's not easy to find what is causing this inflammation, and it can be spread throughout so many different areas of the body that it's hard for a clinician to find the root cause of this. A hernia is where you have an organ protruding through a body cavity wall. This can be congenital, where you're born with it, or it can be as a result of heavy lifting. Males are very prone to having hernias during their early childhood. And also you may hear of people having a hiatal hernia. that is where a part of the esophagus protrudes back through the diaphragm. Surgery is usually very effective in treating these hernias, repairing, pushing basically the part of the organ back through the cavity wall, through the muscle through which it has protruded, and then stitching back together. Myopathy. Pathy refers to disease. Myo, remember, is muscle. So there are any number of myopathies that you may see in your clinical studies. Some additional clinical terms we'll look at are strains. Strain is simply a pulled muscle. It could be excessive stretching or tearing of the muscle. A spasm is an involuntary muscle twitch, usually due to a chemical imbalance. And a prolonged spasm is what we call a muscle cramp. So this can be because of a lack of blood flow or an ion imbalance. Obviously, it should be pretty easy to understand how an ion imbalance, remember, sodium, potassium, all of those are ions. So those could lead to a prolonged cramp. Dehydration is going to increase the ion concentration both inside and outside your cells, and then can affect the way that muscle contraction occurs. And in extreme cold, when your muscles try to contract for prolonged periods of time, they can go into a state of cramp. So when you have some of these, I hate to say it, but somewhat minor disorders associated with muscles, you may hear rice or even price, P-R-I-C-E, as the treatment for that. So if it includes the P for price, that is pressure. So pressure in the form of compressing that area with a bandage, rest, ice, compression, elevation. These are all very common treatments for pulled muscles. So it helps to get the weight off these muscles, to wrap them and to put ice on them to decrease blood flow, and of course to elevate them above heart level, which decreases that blood flow as well, and also helps to alleviate some of the swelling and edema that may be associated with this by making the job easier for your lymphatic system. Okay, quick correction there. You may have noticed as I was talking about rice and price, I was fumbling around for a few minutes because anytime you talk as much as I do, you're going to make a mistake, and sometimes your brain's trying to fix it faster than your mouth can get the words out. Price includes protection. That is the P. So protect, rest, ice, compression, and elevation. Sorry about that, guys, but I'm glad I thought of it in time to get it corrected for you.